Barat membina putra dan putri negeri, berpikir cerdas, jujur, amanah untuk mencapai cita-cita mulia. Yayasan Pendidikan Sumatera tinggi ilmu dan teknologi demi masa depan makmur sentosa. Universitas Sumi berpikir cerdas, jujur, amanah untuk mencapai cita-cita mulia. Yayasan Pendidikan Sumatera Barat mengabdi mengemban amanat bangsa, menjunjung tinggi ilmu dan teknologi demi masa depan makmur sentosa. Demi masa depan makmur sentosa.
Okay. Next, address from the university's rector and the opening of the Nursing International Conference. As the rector is unable to attend, this Dr. Putih Dwi Untari MKM. Let us now listen to the speech and opening by Dr. Putih Dwi Untari MKM. To Miss Putih, the time is yours.
Thank you, Miss Dara. Is my voice clear, Miss Dara?
Yes, Miss Putih, go on.
Okay. Assalamualaikum warahmatullahi wabarakatuh. As we conclude, let's take with us the knowledge, connections, and inspiration this conference has ignited behind healing hearts and nurturing lives. By embracing innovation and compassion, we shape a future where cardiac nursing and newborn care flourish. Thank you for your dedication. Together, we'll continue to bring positive change to countless lives. To all of our distinguished guests, speakers, panelists, and participants, thank you for being here. Welcome and enjoy the conference. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Thank you for the remarkable speech, Ms. Putih. And okay, the next part of the event is the main event for today, which is the international conference, and will be moderated.
Thank you, Ms. Dara.
Keren. Ini sebar maju.
Excuse me, is my voice quite clear?
Yes, Ms. Fatrida, you can continue.
Oh, okay, wait a second. Is everybody for today's seminar? It's my pleasure to welcome all of you in here to the Nursing International Conference, Healing Hearts, Nurturing Lives, Advancing Cardiac Nursing and Newborn Care for a Healthier Future. Okay, ladies and gentlemen, firstly, I would like to say hi to all of my the participants, not only from Indonesia, but also we noticed that some participants from Malaysia. Good morning from Indonesia. Ladies and gentlemen, good morning. Nice to see you in here. Ladies and gentlemen, heart disease is one of the leading causes of death in the world. According to WHO, around 16.8 million people worldwide died from heart disease, which means that accounting for 1 in 3 deaths worldwide. As a matter of fact, newborns as the most vulnerable individual should have access to essential newborn care, which is the critical care for the very stage of life. Therefore, due to their significant role, both cardiac care and newborn care should be advanced and improved continuously. On top of that, to facilitate the sharing knowledge, experience, and the latest innovation, so this seminar brings together the knowledgeable and expert keynote speakers together to talk and discuss about these issues. First of all, I would like to reintroduce, and like to greet our keynote speakers that I see all of them are together with us today. Firstly, I will say hi to Professor Dr. Farida Muhammad Said. Are you here with us, Professor
Yes,
Farida?
hello. Hello, Assalamualaikum.
Hello, yeah. Waalaikumsalam. How are you doing, Prof?
Okay, I'm good. Thank you for the invitation.
Gladly to hear you. Okay, Dr. Farida Muhammad Said will be our first speaker. She will present about digital innovation in primary and tertiary cardiology nursing. And then can wait to hear for your presentation. And the second speaker, the second presentation should have been delivered by Dr. Tommy Diandes, but unfortunately, he cannot make it right now due to the urgent call from the hospital. Okay, this is the biography of Professor Dr. Farida. So she holds PhD in Community Education and Development from University Putra Malaysia. And right now she is the senior lecturer in Lincoln College University, Lincoln University College, Kuala Lumpur, Malaysia, as well as the Deputy Dean of Postgraduate Nursing Studies and Research. Right, proud? Okay. And our third speaker is Mrs. Hilda Marianda. She is the PhD candidate of Medical Science, University of Tsukuba, Japan. Hello, Mrs. Hilda, are you here?
Yes, I'm here.
Okay, I'll hear you clearly. Mrs. Hilda will share her thoughts about maintenance of heart health. She is the PhD candidate of Medical Science in University of Tsukuba. And we saw that she has prominent leadership in many fields, especially in social activities. Okay, and also she gains the graduate program from the same university as she is pursuing the PhD right now at the Tsukuba University. And our last but not least speakers is Mrs. Rahmatul Ulia. She is the PhD candidate of Medical Science in Lincoln University College, and she will share her thoughts and experiences about safe and enjoyable aromatherapy for babies. And she is currently working at the University of Sumatra Barat as the head of Department of Midwifery. And she is certified as aromatherapy baby spa and for the baby. Okay. Well, to move on, ladies and gentlemen, to kick off our first session, I would like to invite, I would like to invite Professor Dr. Farida Muhammad Said to present her presentation. Are you ready, Prof?
Yes, I am. Thank you very much.
Okay, time is yours.
Can I share my slide?
Do you want us to help you to share your presentation?
No, can I manage my slide? I manage, yes. I will share my presentation.
Okay.
Allows for the multiple participants sharing.
Do you have trouble to share your presentation? I'll let us do it for you.
Yes.
Okay.
Think what you have to do. Yes, can you please?
Sure, surely.
Share screen. Open that multiple participant. All right. Okay. Is it audible? Can I see my slide? Can you see my slide? Yes.
We haven't seen any, only the black screen. I thought this is because I think this is because the bad connection. Yeah, our committee has
maybe yes.
The slide has been on the screen, so I think we can start the presentation, Prof. Farida.
on your side, you have that presentation. I cannot see from your side. Okay. Can I start? Is it on the first page?
Yes, this is the first
Hello.
page.
All right. Can you see my slide? Is it from me or from your side? Sorry.
This is from our side.
All right. Okay. Okay. I think we try to synchronize. Thanks, the Yayasan, for inviting me, and thank you so much. Nursing, the hope for the healthier future. The reason why I choose this tertiary care because this is the nursing role in providing the primary and tertiary care for our future, our society. All right. So if you look at the cardiac nursing, I think I was in cardiac unit in 20 years ago. So now the cardiac nursing innovation and training is going on. So you can see digital cardiac nursing care is in the future. So digital cardiac nursing our nursing care. All right. Am I on the third slide? Patrick? All right. Is it okay now?
Prof. Rida, excuse me. We are very sorry that we cannot hear your voice clearly. I think this is
I think because of the
bandwidth
connection.
is very low. I think so.
Oh, the time. Yes. See, all right. So how can we improve on that? What can we do with that? Can you hear me now?
Yes.
But when I present, you cannot hear me. All right. Okay, can I continue?
Sure, Prof.
So now we are looking at what is cardiovascular disease and why it is very important. All right. So I'm in the third slide. Okay. Can you see my slide? All right.
We are in introduction now.
Introduction. All right. Cardiovascular disease or CVD is any condition affecting the heart or blood vessels and the leading cause of death, as mentioned earlier on. And as we know that many reports, whether it is international or in national, the World WHO has reported that cardiovascular disease is responsible for many deaths. And every year it is increasing, and it is going to be expected the increased numbers by 2030. So the cost of that CVD is not only burden to the patients, but is also burden into the economy of the patient as well as the organization. All right. Okay, the prevalence and the cause of cardiovascular disease indicate that there is an urgent need for solution to excuse me, is there any, somebody is sharing my screen?
Yes, the screen has loosened, but I think you still continue while we are trying
right.
to fix this your screen.
Okay, this is some of those technology or the technology challenges that we have to adopt and adapt, all right? The prevalence and cause of CVD indicates that there is an urgent need for solution to raise the standard of care. They are talking about the standard of care and to improve patient outcome for a better future, all right? Okay, now let us look at what are the burdens vascular disease in Southeast Asia. So if you look at the graph here, among the 18.6 million CVD deaths worldwide in 2019, 58% occurred in Asian countries. It's quite very, very high. CVD death in Southern Asia was most dominant by ischemic heart disease and stroke, counting for 60%, 62%, and 57%. So the thing is that how our Asians have influenced the contribution of cardiovascular disease. So if you look at in our graph here, all right, so Indonesia is one of the highest number of people with the cardiovascular disease, all right. All right, in terms of the mortality rates and stroke among Asian countries, if you look at this diagram, all right, they have two diagrams here. We have one with the shaded with red, one is with a darker brown is stroke. If you look at the graph itself, it's mentioned that Malaysia has the, okay, I think I had problem with my internet because I'm still getting internet. Okay. In Malaysia itself, we have the highest number of ischemic disease, but Indonesia have the higher that we have to look into. Okay, now we go to the digital cardiology nursing care. Why we need to go for the digital nursing? The digital informal caregiver or directly support person in need.
Ladies and gentlemen, unfortunately, it seems like Professor Dr. Farida, we've lost her because bad connection. So, oh, she's been here suddenly. Hello, Prof. Hello, Prof. Still working on the bad connection. Professor Farida?
Yes. Yes. Yes, I'm still here.
Okay,
I'm
thank
still
you.
alive. My heart's still beating.
Me too.
All right. So we have to maximize our life with these challenges. Okay. Now we look at the technology that offer the cardiac treatment. See if many technologies that have to improve on the heart health. Okay, we have a cardiac analysis, we have athletic performance analysis, and we have predictive medicine. Everything that is related to how to improve the cardiac of the patient for the better future of their outcome. All right. So I'm not going to touch on what are the different analysis of that the technology for the health hub. All right. Hello.
Yes,
Hello.
Prof. Yeah,
Yes. Now I can see my slide.
thanks God.
Finally. It is managed by you. Okay, that's it. All right. Okay. Can you go to the next slide, please? Can you go to the next slide? All right. Okay. Are you okay? No, okay. This is no. The first slide, the previous slide. Slide before this. Level of prevention. Right. Okay. So now I would like to emphasize on the level of prevention in cardiovascular disease. As a nurse, most of our nursing care focuses on the primary prevention as well as the tertiary prevention. Because I think as what we want is that to prevent people from getting the disease so that they can have a many efforts have been done in preventing this cardiovascular disease, inclusive of all those health promotion, which we advise them to have a healthy lifestyle, especially in controlling their diet, controlling their smoking behavior, controlling on their physical activities. Everything has been done, and we always encourage people to have a healthy lifestyle so that they can have a healthy health. So if you want to have more of those information on the level of prevention in cardiovascular disease, you can go through these articles, which is in open access, right? Okay. Okay, now we move to what are the activities we have. Can you go to the next slide, please? What are the activities that we have done in terms of prevention of cardiovascular disease? Can you go to the next slide? Can you go to the next slide? Okay. All right. What are the different, yes, thank you. So what are the different models or strategies that we use in terms of prevention of this cardiovascular disease in terms of the primary prevention? So we always create the awareness. As I mentioned earlier on, we always create awareness on the healthy lifestyles in terms of the diet, in terms of their physical activities, in terms of their regular checkup. As we know that our current lifestyle is always very dynamic. With the new generation where everything is in a rush, so stress is one of the factors that can contribute to the cardiovascular disease. And another factors that contribute to the cardiovascular disease with the current situation or current environment or current lifestyle is the output diet.
Hello, Prof. Farida. Ladies and gentlemen, we ask for your patience. We're waiting for, okay, we've seen you again. Excuse me, Prof. Farida, you are muted.
Yes. So we have to learn how to be less stressful so that we do not have that cardiovascular disease. All right. All right. Okay. Can you go to the next slide? Next slide, please. All right. So as I mentioned earlier on, we have a lot of awareness programs. Everybody is aware with all those healthy lifestyle, how to prevent. But unfortunately, because of our lifestyle itself, so we could not abide or adherence to that lifestyle. So now with the current situation, with the current technology, we have all these gadgets to help you to monitor yourself on your health as well as your cardiac health. So we have our digital health technologies, including the e-health, m-health, telemedicine, wearable devices, sensors, and artificial intelligence or AI in providing the opportunities to improve access to the delivery of care. And not only to the delivery of care, it also access to your own health. Okay. It also employs for health education and awareness program by using the text messaging approach. We also have that remote monitoring and support, and also we have all those telemonitoring in place. All right. So not only on that aspect, they also have some diagnostic tools, which, for example, like a machine learning and deep learning approach for the detection of diabetes, retinopathy, and skin cancer as well. So we have a lot of improvement. We have got a lot of advantage from this digital health. All right. And currently, if you look at our society now, a majority have that digital health provide opportunity to understand the disease trend, gain insight, patients health, better prediction. We have future health and outcome, and to support the individual care. So if you look at the current lifestyle, is that everybody is with the digital watch to monitor their health so that they are aware of their cardiac health. All right. Can you please go to the next slide, please? Next slide. All right. So why digital approach? Why not the conventional one? Now is the new system or the new era where everybody is using digital. if you look at the market survey, everybody is willing to use the digital more than those people who are not sure. So in other words, we have to improve on our healthcare by using the digital, especially when you want to control all those people from far from your healthcare system. But on top of that, it is that digital is also can improve on the social. We're going to improve on that our SDG, sustainable of development goal, where you can have that better health outcome for the patient. Can you please go to the next one? Next slide, please. All right. Digital nursing. Are we in the digital nursing? Digitalization healthcare has transformed treatment to be more efficient, effective, accessible, and available. Nursing can also increasingly transform with the digital technology. Nurses' transformation with digital, you know that it is being implemented. We have artificial intelligence. We have also internet, mobile webs, and so on. There are so many of those nursing care has been utilized all those digitalization.
Hello, Prof. Farida. I think this is again and again due to bad connection. So we are still waiting for Professor. While waiting for Professor Farida, I would like to remind for all of the participants, after all the presentation done, there will be a question and answer session. So we encourage the participant to keep focused so we can have a deep discussion after each speakers deliver their presentation. The second would be Ibu Rahmatul Ulia, and the third one will be Ibu Hilda. I would like to invite again Professor Farida. Are you here with us, Professor Farida? Not yet. I think we've lost. Yeah. Hello, Professor Farida. We already see Professor Farida on the list of the participants, but I think glad to see you again, Professor.
Yeah, but
Technology is so
all right,
challenging,
okay.
right?
Can you move to the next? Okay, can we move to the other one? Can we move to the next slide, please? Move to the next slide. Next slide, please. All right. So the development and adaptation of digital technology in heart failure care, that is the artificial intelligence. So if you look at this figure, how much of those technologies developed in terms of how to improve the healthcare. Okay, can you go to the next one, please? Move to the next. All right. So what are the trending now? The trending of digital health innovation to improve cardiac disease care is that now we have that smart stethoscope. All right. So we used to have that conventional stethoscope. So now we have the smart stethoscope where you can see the reading at once. We also have that wireless patient monitoring. So this is very important to have that remote monitoring for the patient. Can you please go next slide, please? All right. What are the impact of cardio care? So based on research, they have noticed that there is a lot of improvement of that digital cardio care. You see a research done by many studies. So if you want to know what is the outcome, you want to read more on the articles, they have open access. So it shows
Ladies and gentlemen, we are sorry for the bad connection, and we have lost Professor Farida. Okay, let's enjoy this moment. Let's not to be stressed, because as Prof. Farida said, that stress could contribute to cardiovascular disease. We are still waiting for Prof. Farida to be joining with us again. So for the question and answer session, later participant could utilize the raise hand features on the Zoom apps to speak directly to the speakers, or you can send a comment via chat room. So Prof. Farida has a wide range of experiences in the area of clinical, academic, and nursing management. So she is not only as the academic, but also as a professional in nursing management. And her research interest currently she focuses on patient-smart e-health, education, and quality improvement program, QIP. So that's why on the presentation, Prof. Farida talk a lot about digital improvement tools and how to in order to prevent and also manage health using digital health approaches. Our committee is trying to figure out what with this situation.
Ayolah, ngomong. Iya.
Prof. Farida, a little while waiting for Prof. Farida, I will try to read her biography. She consistently received research grants, especially on nursing development, particularly in marginal communities, such as for deaf community and also children with special needs in Malaysia. And also she has many publications. Not only that, she supervised many PhD students in nursing. As the keynote speaker, she experienced not only locally, but internationally approved. Okay, we remind for the participants, you can, for those who just come in and join with us today. So this event is organized by Universitas Sumatra Barat, the Faculty of Health Science, in collaboration with University, Lincoln College University, and also Tsukuba University. And today we already invited 4 keynote speakers. Unfortunately, one of them, Dr. Tommy, cannot make it today due to the urgent call from the hospital. And right now we are still in our first session about digital innovation in primary and tertiary cardiology nursing. And right now we are still waiting for Prof. Farida to rejoin us on this seminar. And as you can see, there is an attendance list on the chat room. So participant could fill in your data. And this attendance list will be used by the committee to organize the certificates later.
Their lining of your intestine becomes damaged. But the infected patient is highly contagious.
We just received a message from Professor Farida. She is trying to figure out the connection, and hopefully in a few moments we will see Prof. Farida again on this Zoom meeting. Ladies and gentlemen, in order to increase our stress, so let's turn on your camera, make yourself comfortable. give your very best smile and let's take a picture together. Okay, all participants, please turn on your camera.
Yeah.
So we can see your face, your smiles. Okay. Our committee will have to capture. I think we have more than 10 pages. How many pages, Pak Dian? There are 10 pages. So always be prepared because we don't know in which pages we are. Can we start, Pak Dian? Okay, we start from page 1. Smile. Okay, second page. The third page. We move to page 4. Again, we encourage participants to open the cameras because we are taking pictures together. Page 4, page 5. We move to page 6. The 7th page. The 8th one. Page 9. And the last page. Thank you. Ladies and gentlemen, as we delivered at the first meeting that previously. Hello, Mr. Rafi.
Yes, is it audible?
Are you here?
Yes, yes.
Okay. Nice to meet you. How are you, Mr. Rafi?
I'm good, thank you.
Okay. While waiting for Professor Farida, would you like to share your experience and about this, or you are you present
As a less
lecturer?
Yes.
Oh, I'm sorry. So, Mr. Rafi, could you please to share a knowledge of advanced cardiac care?
Thank you very much. My name is Ravi Kumar Katta. Basically, I'm a physiotherapy lecturer, but currently I'm working in the sports science now. I have been working here more than 12 years in Lincoln University. Currently, I just moved to sports and fitness.
Oh, thank you, Mr. Rafi. So you are a lecturer in the sport department.
Sports and fitness. Sports and
fitness. Okay. I would like to ask something because this is very interesting. Sport should contribute to our health, right? But this is so contra some of the prominent actors or actresses that we know that they have healthy life cardiac vascular disease.
Yes.
That's very shock for everyone in Indonesia. So could you please explain a little bit?
And also if they're having any comorbidity risk factors, such as if they're having any smoking habit, alcoholism, without cool down and also warm-up sessions. So they may chance to get this type of the issues, especially if they are like a cardiac abnormalities. So that's the reason before practicing these things, so they have to know their capacity rhythm. So before that, so they have to check the blood pressure and also pulse, and also their endurance level. Normal like risk factors such as any lipid profiles, if they're having any cholesterol levels.
Okay, thank you, Mr. Rafi, for your detailed information on that phenomenon.
Actually,
Ladies
basically,
and-
I'm from physiotherapy. My specialty is neurology.
Neurology and physiotherapy. Farida again with us. Hello, Professor Farida.
Hello.
Hello.
So no stress
No stress, because stress increases
of CVD. All right. So actually, all the stress is teaching us how to maintain our coping mechanisms. I'm not sure. Now we move to another internet access now. All right. Can we go to? All right. Okay, we stop here, right? So studies have shown that how this cardiac digital cardio care healthcare status of a person there. All right. So it is now a trend for our nursing healthcare professionals to be more alert of this digital. Okay, as I mentioned earlier on, there are many studies that relate with how this digital healthcare can improve the health status of the patient. They are able to help in BP monitoring of the patients in terms of medication list as well. They have this MedFriend, so where they can have that what do you call that? Distant consultation. That means that they do not have to come to the hospital, because you know that when patient have already been discharged, when they want hours and we have to wait for days for their appointment. So with this digital, it can improve on the patient outcome. All right. So can we go to the next one? All right. So now what I'm going to focus more is on the tertiary heart attack, or they have CVD. So what will be the next step? That is not the end of their life. They have to have a better future in their life. So we need to have some modalities or some strategies to improve. Before that, we do have that rehabilitation and medication prescribed to the patient. However, to the rehabilitation and medication is always a very poor, what do you call that, impact by the patient. But we could not, and we should not blame the patient for not complying to the rehabilitation as well as the medication. Because, you know, when we have all those information which is not clear and patient is not sure, so they have the tendency of the non-compliance. So with the help of this digital, it hopes that it can improve on the compliance of the rehabilitation by their own control. All right. Can we go to the next one? So what is cardio rehabilitation program? Cardiac rehabilitation program is a medical supervised program designed to prescribe exercise, the health education, counseling of patients with the cardiac disease. But this is all has been done previously. Unfortunately, because of that poor monitoring as poor consistency, the patient did not, so they did not know who to ask. So definitely they will say, I will omit or I will not take the medication in order to prevent any complication. So all this is not, you cannot put the blame on the patient itself. So hopefully with that, so for the CRP, they have 4 phases. Can you go, please, next slide, please. Next slide. What are the 4 phases of that cardiological intervention? So in the exercise training, of course, they have all those different types of in terms of lifestyle modification, of course, because many studies have shown that smoking is one of the factors that can. So hoping by that that self-monitoring digital application, they should be able to control their smoking eagerness then. Blood pressure control, this is normal. And with that, they should be able, as well as avoiding overweight. So this should be in that our lifestyle modification digital application. Psychological intervention by reducing stress, like currently we are having now, and reducing anxiety. Next, please. There has 4 phases of that cardiac rehabilitation program. Phase 1 is the inpatient period, self-monitoring and follow-up, and number 4 is lifetime maintenance that is specifically in the community base. Okay, next slide, please. Next, okay. In phase 1, that is inpatient, a visit by the member of cardiac team rehabilitation program. So they will be providing all those necessary information, which include the health education regarding the disease and the recovery process. So they have to be well informed in terms of what are the factors and how to prevent of the recurrence, as well as how to improve their recovery process by following the instruction. Personal encouragement and empowerment. This is very important in terms of how can we encourage and motivate the patients that they have to be actively support the cardiac rehabilitation program. The inclusion of family members in the cardiac rehabilitation program is very important because that is their support group. Okay, next, please. Next slide. All right. In phase 2 is in the outpatient, where the patient will discharge within 2 to 6 weeks of the recovery at home. So they have to come for the outpatient. In patient with congestive heart failure before begin any cardiac rehabilitation exercise program. So this is very important. This is the baseline. The level of exercise necessary to meet the individualized patient needs formulated after capacity function. And a constant medical supervision and health education is provided. That means you keep on reminding what they're supposed to do during their recovery period in terms of their lifestyle, in terms of their physical activities, and in terms of their information on what to do and what not to do. Okay, so this program is lasted about between 6 to 12 weeks. All right, next, please. Phase 3 is self-monitoring and follow-up. So nowadays, I think everybody is aware that we are encouraging the patient-centered care, whereby in patient-centered care, we encourage the patients to have self-care. All right, self-monitoring heart rate, responses to exercise, and rate of perceived exertion on their own, or RPE. So they have to do all those things on their own, because remember in phase 1 and 2, we already explained to them what are the process of that cardiac rehabilitation. So they have to follow all this, all right? And the patient continues to progress the exercise and physical capacity and maintain to improve the functional, and it's important for our nursing personnel or any health personnel to really emphasize on the patient of what are they supposed to do in that recovery process. Next, please. Next slide. Next slide. All right. The last phase is that phase number 4, that is lifetime maintenance. That means that they already adherence, and they should be able to maintain. This is independent ongoing maintenance whereby the individuals safely exercise home or in gym setting. Empower and facilitate long-term maintenance of lifestyle change, monitor risk factor changes, and also as the secondary prevention. So this is very at the end when the patient is able to, okay, thank you. Next one, please. Next slide. All right. Okay, now I would like to share what are the innovation that we have already started and we feel that it can improve on the right in some of my students in terms of how to control their hypertension. We know that hypertension is one of the risk factor of cardiovascular disease. So our research found that there's a lot and in terms of how to control the blood pressure by controlling their diet. We also pay attention to that. So we already have this innovation as well. Next slide, please. Next slide. Another intervention that some of the students, the very smart students, have done is that they produce a digital application by the name of DETA. So I don't know how maybe in Indonesia the pronunciation is different. So we call it a DETA, where it is the mobile application where it is. So this is a very good application whereby you can have the early, remember in any treatment, you should have early detection. So you can have early treatment so that you can prevent for further complication. And the result was very significantly improved on how people can be preventing their cardiovascular disease. All right, the next one, please. Next slide. Okay, this is another what do you call that? Research done by the student in Lincoln is that they have some application, the smartphone education application. This is more of a promotion of how to improve the quality of life for people who have coronary artery disease. So it also includes, as I mentioned earlier on, about the how to control the lifestyles, the physical activities, as well as the diet. So majority the students, the patient really significantly what do you call that, improve on their knowledge so that they can control all those risk factors. Okay, next, please. Next slide. Okay, the last slide is that about the efficacy and feasibility of cardiac rehabilitation digital application in low-risk acute cardiac patient to a cardiac event in Riau province, Indonesia. So we found that the many patients who have this rehabilitation program did not comply to the rehabilitation activities. The reason being was that it's very far for them to go to the rehabilitation center. Number two is that because of the time. You see, some of those, as you know, that those people with cardiovascular disease, now the age is getting younger. So some of them are working. So that is the reason why they say they have time consuming, or when they go to the clinic or when they go for the rehabilitation, so their time will be what we call that the time consuming, which lead them to be non-compliant to rehabilitation. So we hope that by having this rehabilitation, a digital quality of life and the life of those patients with cardiac disease, right? Next slide. In conclusion, digital technology support better outcome and experience of care in patient, all right? The race of smarter digital tool that is multi-parametric data provide a new opportunity to improve the clinical outcome for patient and improve the convenience and accessibility of the service. Remember that the new era of our patient is that they want to have a convenient and effective and efficient services. As digital health become part of our new normal, nurses need to ensure to identify the right to be used. You have to consider their age and their condition as well. Their social setting and the digital illiteracy as well as the healthcare environment. Digital technology will undoubtedly be the center of this process, but human factor will still remain the key. You can use any types of robot, but the thing is that we still need to have that human touch, all right? Digital technology not to replace human contact, but should enrich and enable more patients to access appropriate care and support at the right time. Because, for example, based on my experience, we have all those telemedicine where the patient are able to contact the person who they wanted to contact. So they give all the instruction, but what he wants is just to hear from somebody who can give them more of that human-to-human advice compared to just on that line. So in other words, is that despite all those technologies, we do still need to have that human touch as well in our nursing care. All right, next, please. Next slide. Okay, so all those information is accessible to any of those any journal, so you can access to all those information. With that, I would like to thank everybody for patiently waiting for me, and I do hope that this presentation help us to look into what are the new way of how to provide care to the cardiac patient. Thank you so much.
Thank you, Professor Dr. Farida Muhammad Said. What insightful and inspiring lectures. Although we faced a lot of obstacles at the first,
Yes.
but at the end, we successfully overcome it. Thank you for the lectures about how to utilize and take benefit from digital innovation. Of course, of the seminar, Prof, because at the end, we will have a question and answer session.
All right. Okay.
And thank you. Thank you.
Okay.
Well, ladies and gentlemen, applause for Professor Dr. Farida. And for the next speaker, we are moving to Mrs. Hilda Marianda, MPH. Hello, Mrs. Hilda.
Hello, good morning.
Good morning, Mrs. Hilda. How are you?
Very well, thank you.
Okay. Ladies and gentlemen, Mrs. Hilda is a PhD candidate at the University of Tsukuba, Japan, especially in medical science, and she was awardee of Honjo International Scholarship found Japan on 2022. At the same year, she also received Dana Penelitian Hibah Dosen Pemula. On top of that, active in social community activities. Well, without further ado, please welcome Mrs. Hilda Marianda, MPH. Time is yours.
Thank you very much, Ms. Fatrida. So let me share my own screen. Okay. There it is. I hope, okay. It should be on the slideshow. Let me check, is it moving?
Yes, correctly.
Okay, perfect. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much first for the opportunity that has been provided heart health now and later. So I'm basically doing a public health major now, but I finished my bachelor in Universitas Indonesia in nursing science. So I was a nurse, but now because my master and now my PhD, I'm focusing on public health. But somehow I think it's really related, and I will some message about how to prevent and how to promote, because previous to improve the outcome from digital approach, and so now I would like to talk from other perspective. So let's move. If I'm speaking too fast, please just tell me, because sometimes I don't know my speed. Okay, this is the content of my presentation. I just divided into three. The first is the introduction, and the second is public health, and the last is the conclusion. As the introduction, as Professor Fadel also have provided many information about the CVDs. And I think many countries are struggling to reducing the numbers of non-communicable disease. Non-communicable disease in Indonesia, we say penyakit tidak menular. So one of the highest contributor is CVDs, or cardiovascular diseases, and a healthy heart is essential to overall good health. So where should we start? I will start from the introduction. I will show you the burden of diseases that what we are facing right now. Indonesia is facing double burden, or even triple. We are facing the non-communicable disease. We keep improving. we keep increasing the numbers of penyakit menular and penyakit tidak menular. So we have the double burden disease, or even triple. What is the other one? The other one is like COVID. We have the pandemic. We have the outbreak. That's what it's called, triple. So the fun fact that NCDs are the result of combination of genetic, physiological, environmental, and behavioral factors. I think I will highlight here from genetic and behavioral factors, because I will talk more about this. And I think the epidemiology of CVDs that have been told by Prof. Farida before. So I will just emphasize some part. Like over 3/4 of CVD death take place in low and middle income countries, which means Indonesia is here, and most CVDs can be prevented by addressing behavioral risk factors. And it's important to detect CVDs as early as possible so that management or the outcome can be optimized. This is just a graph that you can see that here's the age standardized daily disability adjusted life years. So we can see that Indonesia, the color is dark orange or almost red. So it means that we still have the low cardiovascular diseases. And this is in South Asia. And I think Indonesia is here. It's here as the highest contributor for our mortality number is stroke, but we still have TBC here, tuberculosis. So it's a communicable disease, right? So in Indonesia, we still have a lot of homework to do. And I will emphasize here it's neonatal mortality. It's also quite high in Indonesia. Because next I will talk more about the congenital heart diseases. Okay, this is the congenital heart disease, because the main topic about this conference is about the nurturing, in approximately 0.8% to 1.2% of live births worldwide. So we can see and in 2017, CHD caused approximately 260 60,000 deaths globally, and mostly occurred in the low middle income countries. And I think Indonesia is here. And for most of the severe congenital conditions, the mortality associated with the condition is highly dependent on access to adequate surgical intervention and other medical care. In here, we are talking about the curative, what to do when the baby already got CHD when they are born. And the intervention during the first hours, weeks, and years of life is really important. And in Indonesia, CHD is the most common cause of death from all congenital abnormalities. Occurs about 8 in 1,000 life birth, and mortality occurs within the first 6 months of life, and 80% of them occurs at the age of the 1 year. This is the complication of CHD. Why congenital heart disease is really should be considered as a problem. The first one is, of course, is mortality. The number of neonatal mortality, or the mortality of the babies, is one of the indicator of well-being in a country. So if we have high mortality, neonatal mortality, so the well-being it's still much low than expected. Why CHD can contribute to mortality? Because usually it can cause sudden cardiac death and heart failure. And for children, it can influence to their development. They have difficulties in learning, in socializing with others. Yeah, and this kind of and the delays of the development can lead to problems with their social interaction in the end. And the morbidity as well, because the CHD babies or CHD people, they have they're easy to get to infected by any virus and others. They have higher risk to develop respiratory tract infections and endocarditis, as well as the expenses. More than 200,000 people die every year at the cost of more than 9 trillion rupiah. So it's a lot of cost. And I will tell you the risk factors of CHD. Because CHD is one of the, so that's why some risk factors is likely with CVDs. The first one is dietary deficiency and substance abuse, especially during the pregnancy. The intake of the nutrition before and during pregnancy is really matter to the CHD. And the second one is low quality of antenatal care. As we know that in Indonesia, especially in rural areas, we have still limited access. Even we have like primary health care in some areas, but the awareness of the people, of the mothers, in magic, they don't think antenatal care is important. So that's why sometimes they don't get appropriate access for antenatal care, and they don't get the right amount for folic acid. And the third one is obesity and diabetes. And during pregnancy, of course, we have gestational diabetes. It's really it's also contribute to the CHD. And the last is genetic problems. And so this before there was production. That's why we think that public health approaches are needed, because many developed countries now what they say, they spend more money in preventive and promotive because it can provide a better outcome rather than the curative. But of course we have to focus on curative also, but in the other way we have to start to think about the preventive and promotive. As the outcome, we are expecting decreasing the incidence of CHD. And the second one, we are expecting to promote the quality of life of people with CHD. So how to optimizing the target? I will introduce you the framework of CHD. It's been applied in some developed countries to as I mentioned before, to reduce the incidence of CHD and to promote the quality of life of people with CHD. So in framework of CHD, we have 3 big steps. The step 1 is identifying and investigating. The step 2, develop the intervention and policies, and the step 3 is implementing, and the last one, monitoring and evaluating. I will talk more after this slide about each step. So the first one is identify and investigate. What to do in this step? As a public health expert, we have to monitoring both the prevalence and the outcome. What is the prevalence? We have to focus on the CHD prevalence at birth and across the lifespan, as well as survival, morbidity, and disability at any age. So, because in some countries, the intervention for CHD that has been implemented has a good outcome. So some CHD babies, they can grow up into adults. So the survival rate is quite high in some countries. So that's why this framework also focus on them. The second one is identifying the evaluation of previous programs. If we have the previous program that have been implemented, we also have to identify like how is the result and how's the feedback and anything, and monitoring and also we need to monitoring the recent research to forward for investigating might be related that can improve our outcome. And the second step is intervention should be improving the health and well-being of people with CHD. Like in Indonesia, we I don't know, this is some articles that I've read that since last year, in the end of last year, or catheterization laboratory, by providing this facility, we can decrease the hospitalizations, the hospital and as well as for the countries. And we also should focus on preventing the incidents in the future. And in the implementing step, it's really critical to involve as many stakeholders as possible. I think nowadays we know about the patient-centered, like the patient as the center, like this is the individual, and if the patient has a family, we should empower the family as well, or maybe the parents, or the social and the culture norms as well. We should improve them, we should empower them, we should provide the intervention that can embrace all of the optimal result. I will introduce, especially in Indonesia, we in the rural areas. In rural areas,
Kali saya pun jalan Indonesia, pergi China,
yeah, yeah. What is it? And the recent study found that lifestyle modifications that family-centered that was found to be more likely sustained compared to the other one that only focus on the patient. Like what I've mentioned before about the for the pregnancy mother, the pregnant mother has has ability provided for her, right? Good food if the family or the husband provide for this. So it's really family strengthening. I mean, it's achieve a good lifestyle for adults and others. So it's really the role of the family as actually start from the pregnancy, and then it is important to empower the family. So not only the mothers or not only the patient, but all of the family members. They should know what to do. This is the empowerment. Like the healthy diet, what I've mentioned in my last point, providing healthy diet for children and for pregnancy mothers. I will introduce some working in a hospital or any clinical or any other setting that might be possible for you to end up to give intervention for baby with CHD. So what you have to remember is you have to promote to exclusive breastfeed for 6 months. And a baby with CHD will require extra calories. But if it's need like extra food or extra milk or any others, it should be consult with the doctor first. And the third one, mineral and vitamin supplements should be given according to the doctor's advices. And when the baby has any infection, give extra feed during the recovery. And what not to do? Don't dilute breast milk with water, because baby with CHD is not the baby actually. All of the people with CHD, they don't. We try to avoid more water for them, and feed with formula or cow's milk. It's also should be avoided. And as I've mentioned, that in some countries the intervention for CHD people is getting much better. So usually the baby will grow up until kids or maybe adult. For kid or for adult as well, what to do, what kind of things that should be done. We should provide them with high calorie food like eggs, meat, chicken, or something with solid or semi-solid texture. Yeah, I've mentioned before, right? Don't give too much liquid for them. And small amounts of calorie and nutrient-rich foods can be given more often. Like it's more frequent is important. And limit sodium, cholesterol, and saturated fat for older kids, because it will impact to the work of the heart. And ghee, milk, and curd can be fat as desired. And what not to do? Eat too much liquid and eat junk food should be avoided. And after family strength counseling, screening, and treatment should be improved. Like because of public health, we try to prevent. So if we come into the community and we can do screening, we have to do that. Like when I was in bachelor, I used to join in some community services to provide screening for pregnant mothers and some like geriatric. I often did that. So that was really great if we can inform them what what should be noted by them if they are in risk factors. And the second, multidisciplinary approach to treating people with CHD. And the key is equal access to health facilities. Multidisciplinary mean because I wrote in my previous slide that that people with CHD they easier to get infected, and they have the morbidity higher morbidity to develop any other diseases. So it's important to multidisciplinary approach, like we collaborate with other team, not only from cardiovascular but also with others, because it's really because people with the CHD, can you imagine, they have they know that they have limitation, then maybe their mental problem they also have risk to develop their mental problem, right? So we can collaborate with them. This is the patient-centered, that multidisciplinary approach. And preventing CHD through pregnancy. This is the pregnancy. We have to ensure that pregnant mothers vaccinated against rubella and flu, take 400 micrograms of folic acid during the first trimester. It's really important. And consult the OB-GYN regularly, or get antenatal care appropriately. And if the pregnant mother have diabetes, rule. And what not to do: drinking alcohol, and infection, exposure to organic solvents such as those used in dry cleaning, painting. Once we develop a program, of course we have to know what is the result, right? So we have to develop a valid and reliable measurement which adjusts to the outcomes. Like what was the outcome that you expected? Is it the numbers of CHD, or is it the knowledge that improving, or others that should be adjusted by a valid measurement? So and after we do the evaluate and we get a valid result, we should consider whether we should expanding the program that we develop or not. The last one is the conclusion. So what can we do as a nurse, as a student, and yeah, as a student you can be health workers as well in the future. So what can we do? The first one is keep learning and adjust the newest technology that's available, like what Prof. Farida have presented before. It's all about technology that we have to adjust with that. We have to adapt. We have to adapt. Don't, what do you say? Oh, no way. We get used to it. This kind of technology. Why we should change into other? No way. You shouldn't. You shouldn't do that. You shouldn't be fanatically with one way. We should be flexible, because nowadays technology is really dynamic. We have to move. We have to move fast, and I think that what can we do as a good health workers? We have to adapt with the new thing, and supporting patients to live well and using advanced nurse practice to follow. Of course, it's our baseline. And last is result. Indonesia, this is just the point of the conclusion. Indonesia is facing double burden disease, and NCDs, or non-communicable disease, is the one keep increasing significantly, caused by multi-factors. We have we developed the almost 5 times higher of diabetes number only in the 10 years. And the second one, CVD is one of the NCDs with high mortality, while CHD is one of the biggest contributor to infant mortality in Indonesia. And the third one, Indonesia needs to implement preventive and promotive to decreasing the incidence numbers in the future and better human quality resources. Like we start from identifying, investigating, developing the implementation, and implementing, and last we have to evaluating. Then we come
oil in 1992 and conduct the review so fast with a little pain. And essential oil can also affect your oil stimulate the olfactory nerve, which is responsible for our sense of smell. When you inhale in the aroma of essential oil,